Welcome to This Explainer. Today, we're tackling cardiology's ultimate head scratcher, the obesity paradox in heart failure. How does obesity skyrocket your risk of getting heart failure, but somehow improve your odds of surviving it? It's a wild contradiction that totally trips up med students and residents on the wards. Here's the deal. Overweight and mildly obese patients actually survive established heart failure way better than leaner ones. First, the golden rule. Higher BMI is absolutely a massive risk factor for developing heart failure initially. This is huge in HFpEF, heart failure with preserved ejection fraction. Over 80% of those patients are overweight. But wait, here's the twist. Once heart failure sets in, overweight patients suddenly have the lowest mortality risk. In fact, in-hospital mortality literally drops by 10% for every 5-unit bump in a patient's BMI. Crazy, right? But beware of reverse causation. Cardiac cachexia, that's severe unintentional weight loss, carries a completely devastating prognosis. So what's going on here? Why in the world do heavier heart failure patients actually fare better? We can boil it down to two camps: true biological protection versus clinical bias and confounding artifacts. Biologically, higher blood pressure and extra metabolic reserves let obese patients tolerate much higher life-saving doses of heart meds. Plus, their higher lipoproteins might literally neutralize harmful inflammatory endotoxins during those advanced stages. It's built-in armor. On the flip side, think about lead time bias. Heavier patients feel symptoms faster, leading to quicker, aggressive treatments. Now here's the real kicker. A patient's cardiovascular fitness level matters way more than their BMI. Seriously, this whole paradox just vanishes in patients with high exercise capacity. Fit patients survive regardless of BMI. Honestly, BMI is just a crude tool. It totally fails to distinguish protective muscle mass from harmful visceral fat. So for your clinical practice, do not push aggressive weight loss as the main goal for mildly obese patients. Instead, get them moving. Moderate exercise safely boosts quality of life and functional capacity across every BMI category. The evidence is clear. We need to focus on weight stabilization and holistic metabolic health, not just the scale. I'll leave you with this. On the wards, are you trading a crude number or the whole complex patient?